Have you ever felt a sudden gripping pain on the right side of your upper abdomen that made you stop whatever you were doing? Maybe it happened after a meal, maybe you woke up at night and for a moment you weren't sure if it was heartburn, your stomach, or something deeper. And then someone mentioned the gallbladder, and suddenly you were left wondering, could this be my gallbladder or do I have gallstones? And here's where things get confusing for many people. In a broad sense, gallbladder pain usually falls into two major situations: pain that happens when gallstones are present, and pain that happens even when no gallstones are found at all. And what surprises many people is that the pain in both cases can feel almost identical. So, how do you tell the difference? How does each type present? What actually triggers these attacks? And how do we properly diagnose what's really going on? And that's what we're going to discuss today. We will be talking about gallbladder attacks with and without gallstones. And at the end, I will answer one of the most common questions asked about the gallstones. So stay tuned. Meanwhile, welcome back. I am Dr. Marie Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. Also, I do need to say that the gallbladder topic is dear to my heart, and I wrote a book about it called Gallbladder Disease Easily Explained by a Surgeon. You can check it out on Amazon. The link is in the description of this video. So let's start with the most basic question. What does gallbladder pain actually feel like? Most people point to the right upper side of the abdomen, just under the ribs. Sometimes the pain stays right there, or it may move to the mid or even left upper abdomen, although that's not as common. Other times it radiates to the back or up into the right shoulder blade. It often feels like pressure, tightness, or a deep squeezing sensation that builds over time. And many people feel nauseated with it. They may also feel bloated, uncomfortable, or unable to eat. And very commonly, it shows up after meals. And this pain is called biliary colics. So if you suffer from biliary colics, you may have noticed that it is worse after heavier meals, especially fried foods, cheese, creamy sauces, and the usual restaurant food. And that's not random. Those patterns offer important clues. Now, here's very important part. The same pattern of pain can happen with stones and without stones. So let's look at scenario one. So gallbladder pain with stones. And this is a more common situation where stones form inside the gallbladder and they can block the normal flow of bile. When you eat something fatty, your gallbladder is supposed to contract and release bile to help digest that fat. But if a stone is blocking the exit, pressure builds as the gallbladder tries to squeeze against this resistance. And that pressure is what causes the classic gallbladder attack. These attacks often come on suddenly and can be quite intense. They may last anywhere from 30 minutes to several hours. Nausea and vomiting are common, and the pain often is severe enough that people end up in urgent care or an emergency room. In this situation, diagnosis is usually straightforward. An ultrasound or CT scan typically shows the stones clearly, and the symptoms, the food triggers, and the imaging, everything lines up and adds up. So now let's look at the scenario two. We have gallbladder pain without stones. This is less common situation, and this situation actually confuses and frustrates so many people. Why? Because the pain feels exactly like a gallbladder attack. It clearly comes after meals and it keeps recurring, and yet every scan says there are no gallstones at all. Does that mean that the gallbladder is fine? Well, not necessarily. In this case, the issue is not blockage, it's function. The gallbladder may not be squeezing the way it should. Bile can become thick and sluggish, and bile flow essentially becomes inefficient. Digestion suffers as a result. And that same familiar right-sided pain can still show up after eating. And this is why many people are told that they have reflux, gastritis, IBS, or just food sensitivity, when in reality, the gallbladder itself is still at the center of this whole condition. As you see, what makes this especially confusing is that the symptoms in both situations overlap almost completely. Both can cause right upper abdominal pain, pain after meals, nausea, bloating, and discomfort radiating to the back or shoulder blade. And from the patient's perspective, the experience can feel identical without understanding that gallbladder disease is not just about the stones. It's easy for people to remain stuck without clear answers for years. So, what to do? So, let's look at how gallbladder disease, gallbladder problems are diagnosed. When gallstones are suspected, the first test is usually an ultrasound. Ultrasound is excellent at seeing stones and also signs of gallbladder inflammation. If stones are present, the diagnosis is often clear. But when symptoms are classic and imaging shows no stones, that's when the gallbladder function must be evaluated, not just the structure. This is where a test called a HIDE scan with CCK becomes crucial. HIDE stands for hepatobiliary immunodiacetic acid, and a HIDE scan is a nuclear imaging test that tracks how bile flows from the liver into the gallbladder and then into the small intestine. And that is used to evaluate how well the gallbladder is functioning. The key part of the test happens when a hormone called CCK is given. CCK, or cholecystokinin, is the natural digestive hormone our body releases when we eat fat, and its job is to tell the gallbladder to contract and release bile. So during the test, after the tracer shows that the gallbladder has filled with bile, CCK is given to stimulate contraction. The scan then measures how much bile the gallbladder is able to eject. This number is called the gallbladder ejection fraction. A normal ejection fraction is generally above 35%, often falling somewhere in between 35 and 75%. When the ejection fraction is below 35%, that usually means that the gallbladder is sluggish and underfunctioning, and this condition is called biliary dyskinesia. Interestingly, there are some people who have opposite problem, an abnormally high ejection fraction, often above 80%, which also could be associated with painful, this spasmodic contraction, and that's not very common, and that condition is called biliary hyperkinesia. So as you see, when someone has classic gallbladder type symptoms with either a low or abnormally high ejection fraction, that gallbladder can absolutely be the true source of their pain, even when no stones are present. Meanwhile, so let's look at what poor bile flow does to our body, because bile is not just for digestion. It plays a major role in fat absorption, hormone clearance, toxin removal, and gut motility. So when bile flow is impaired, people may develop chronic bloating, fat intolerance, reflux that doesn't respond well to medications, constipation, pale stools, and persistent nausea. And over time, this can affect far more than just the gallbladder. It can influence the entire digestive system, unfortunately. So now let's move on to treatments. From a conventional medical standpoint, once the gallbladder is clearly identified as the cause of symptoms, whether from stones or from poor function, the standard treatment is surgical removal of the gallbladder. The gallbladder is not an essential organ for survival, and many people do very well after removal, but it is still a significant decision, and it should be based on symptoms, on test results, and on a full personalized clinical picture. From a functional medicine perspective, the goal is to support bile flow, improve digestion, reduce gallbladder inflammation, and address the root cause that made the gallbladder sluggish or stone prone in the first place. And also the treatment is targeted towards nutritional strategies, support for bile production, and also bile flow, support for gut microbiome, for liver detoxification, and the root causes that are being addressed in the gallbladder, those are actually, again, the ones that caused it in the first place. And those causes are insulin resistance, rapid weight loss, or hormone imbalances. And in appropriate cases, I'm going to repeat myself, in appropriate cases, functional medicine approaches may help improve symptoms and digestive function. And in some patients, they may delay or even avoid surgery. Always with careful medical monitoring. Gallbladder disease can escalate and turn into significant obstruction of the bile flow. It can result in sepsis, leading to full body sepsis, and it could be life-threatening. So gallbladder disease is not some minor issue, and avoiding surgery, unfortunately, sometimes is not an option. Now, here's an important bonus question, as I promised in the beginning, and this is actually a very common question. What if gallstones are discovered incidentally during a CAT scan or an ultrasound done for a completely different reason, and the patient has no gallbladder symptoms at all? Should every gallbladder with stones be removed? And the answer is no. If someone is truly asymptomatic, meaning no gallbladder pain, no food-triggered attacks, no nausea after meals, surgery is usually not recommended. Many people live their entire lives with silent gallstones and never have a single issue. Surgery becomes a serious discussion only when stones begin to cause true symptoms or complications. So decision to operate is not based on the presence of stone alone, but on whether those stones are actually causing the disease. So in summary, gallbladder disease is far more complex than most people realize. It can come from stones, it can come from poor function without stones, and sometimes stones can be present with no symptoms at all. So understanding which situation you fall into is what determines the right next step. But of course, I can go on about gallbladder for a long time, but I will stop here. I'm looking forward to reading your comments. Thank you so much for watching. Until next time. Bye-bye.